Well. Good afternoon, everybody. Good afternoon. We are
Good
back.
afternoon. Hey.
Hey, we are back. We are back. That's all I got to say. That's 2 words. We're back.
We back.
We back.
We're back.
We back. After a
back.
long hiatus. After a long hiatus and some much needed rest, we're back. The CareSouth Carolina Community Live Podcast is back.
Yes. And I'm glad to be back, man. I missed everybody.
I did. I really did. I missed everybody, but we needed a break. We really needed a break. We really did. But I'm Mark Calhoun. I'm the Director of Social and Community Services for CareSouth Carolina. I'm here with my partner in crime.
Hi, this is Daniel. I am the MATSD Program Director for CareSouth Carolina. And I'm glad to be back. Glad to be with my partner again, man. You know, like you said, we needed a break. We need to refresh everything and reset and just get some more important information together so we can bring you guys the latest and greatest evidence-based information on all services provided in our communities for our people.
Absolutely. And I think having coming back now was the perfect time because the month of May, we are celebrating Mental Health Awareness Month, and this is the perfect time to be able to come back because over the last few years, so many people, family members, friends, community members, patients have been dealing with so much. And I think it's the perfect time to come back and impart some information on people.
I do too, because mental health is something that touches everybody, everywhere. And so, it's important that we get some information out that, so people can learn how to cope with certain things and know about the services that CareSouth offer when it comes to behavioral health and mental health and everything that's associated with that. And so this month being an anniversary month for something tragic that happened in our, workplace as a whole is a perfect opportunity for us to have a way to cope with those issues and those feelings that we're going to be experiencing here in the next few weeks and even now for some of us. So glad to have two of the most wonderful ladies I know on the podcast today that can tell us a whole lot about what we need to know about mental health and behavioral health services and everything else. So yeah, Marek, man, I'm happy, man.
Absolutely. Like you said, we got the best group of ladies here to kind of kick this thing off and talking about mental health and Mental Health Awareness Month. So without further ado, I'm going to let these ladies introduce themselves. We don't like to get in the way. We let folks kind of do their own thing. This is their platform, just like it's ours. So we just kind of step out the way and then do their thing. Ladies.
Well, thank you both for having us. We really appreciate it. We're excited to be here today to talk about mental health awareness and during this month of May. I'm Robin Gibson. I am the Behavioral Health Supervisor here at CareSouth Carolina, located in the Hartsville office. We have many offices throughout our service area. And this is
I'm Amy Cook. I'm the Director of Behavioral Health, and I'm excited to be here. I'm located primarily in the Lakeview office. However, I do travel to all the different locations on a daily basis. But we're excited to be here to share some information with you about CareSouth and what we have to offer to our patients.
Absolutely.
Wonderful.
Absolutely. And we're happy to have you as well. Daniel?
Yeah, I'm very happy to have you. I'm the program that I'm direct over is an umbrella of behavioral health. So Amy is my immediate supervisor, and Robin is a the name fits so good, Batman and Robin. she's an excellent counterpart to Amy that makes this program such a success. And I'm just excited about what you're going to tell us, all the things that we're going to do. We understand that Amy, we thought we can keep her to ourselves right in the local area, but here for the past couple of months, she's been nationwide. But I'm glad that nationwide is on my side. You know what I'm saying? So,
you have to go to the nation to fight for what we believe in, and mental health is important. So we're going to fight to keep keep access open and services going, and make sure that, we're fighting for, the ability to keep providing those services.
Well, speaking of providing those services, I got a question for you.
Okay.
CareSouth has grown so much. I've been here since 2015, and it has grown so much since when I came to work for CareSouth, we were barely at 300 employees, right?
Mm-hmm.
And so dealing with crisis and mental health issues within employees was a little bit easier. But now I think we've over doubled that amount since I've been here. How many different sites do we have providers in? I mean, just the CareSouth sites, not the offsite services, but right now, just within CareSouth and our different offices, how many providers do we have available to the community members?
We currently have 20 available behavioral health providers. That is including your license, everyone's license, but that is including your licensed master social workers, your licensed independent social workers, and your licensed professional counselors. And we also have Dr. West, who is our clinical psychologist.
Yeah, Dr. West is a cool fella. I like Dr. West. He's pretty cool.
Yeah, he is. And we're located in all 5 counties. So that's Lee, Marlboro, Chesterfield, Dillon, and Darlington. Mm-hmm. I was going to let you represent Darlington,
Absolutely. Absolutely.
So, yes.
That's pretty good. So what services do you offer? What services do you offer to our patients?
So we offer behavioral health services for all ages. We work really hard to make sure that we are able to see the whole person. We don't just see children or adults. All of our counselors are licensed, and they are able to see all ages. So from children as young as 5 years old all the way up to patients in the retirement age, 80 plus geriatric. And we see all diagnoses really, from depression to anxiety, PTSD, your more child diagnoses of ADHD or ADD. And we work a lot with Dr. West being with us. He does all of our testing. So he does basically all of our testing for ADHD, for autism spectrum, Asperger's, academic functional testing, and he actually does testing for cognitive disorders in our elderly patients as well. So we do a lot. We do substance use, substance dependency, any psychosocial need that is needed. We treat the whole person.
So
we can't treat it. We can find somebody who can.
Yeah, exactly. Because we have resources, right? We know people. That's right. We are people who know people. So that's a good thing, right? That's a good thing.
That's a great thing, working in such a good community where we work with each other, and we have these, other agencies that we collaborate with, and we're able to, refer out or even call for guidance and say, hey, I don't know where to or what to do with this particular individual. Help me out.
Right.
And so
that's wonderful. Because I know we have a whole bunch of community partners with us when it becomes behavioral health, a bunch of them, inpatient and outpatient services. And so if there's a lot of people who say, well, CareSouth, they just got started. They just opened that building over there in Dillon and over there in Chesterfield and over there in McCall. So they just really got started, and they don't really know a whole lot about. There is no way, they're not perfect. They just trying to learn this thing now. How long have we had a behavioral health program within CareSouth?
Over 30 years.
Yeah. What? No, wait a minute. Hold on. You said about 30 minutes. Did you say 30 minutes?
No, over 30 years.
So which means, that means that we've been established for a long time, and our services have always been available for the most part to all of our patients, right? Is that what you're saying?
Yes. As we expanded, as far as patients, we made sure at CareSouth that we also expanded our services and expanded the space to see those patients, no matter what the need was. So not just even behavioral health, and we work on an integrated behavioral health model. which is basically we work really, really close with all of the patient's primary care physicians. We work really close to make sure that they're getting all the care that they need, even resources that are needed with our community health worker department. We work obviously with Daniel. He said how great we are. He is so great to work with. And he's my other partner in crime. We'll call him Superman. Because he works with our medication assisted treatment program, substance use disorder program, and has been so effective and has changed so many lives, and is also instrumental in what we have is our rural opioid community response consortium, which he can talk about later in another podcast because we're going to cover that, but we really cover a lot of services, including dental and offsite services. And behavioral health also does school-based services. So we're now located in 15 schools within our
15 schools
within the PD area. Yes.
Get out, Amy.
Area.
Amy, get out. 15 schools.
15 schools.
So which means we know there's a lot going on in the school system when it comes to our children. Our children have a lot of influences. They have a lot of outside influence, familiar influences, and things that call, like you said, Dr. West, people, children on the spectrum and everything else. Are you ladies still there?
Yes, we're here.
We're here.
Okay, because we missed my wreck somewhere.
Marek got lost.
Okay, it just froze.
And Daniel, speaking of our school, can you hear me?
Go ahead.
Okay.
Yes.
I was going to say, speaking of our school-based services, I do know that Laura Chavis, who directs our school-based services, and she is our coordinator of those services, will be coming onto a podcast possibly next week.
Mm-hmm.
And she's going to talk a lot about what they are doing. And it is really some good stuff within the schools. We have, I think she said 5 full-time school-based counselors.
Yeah.
And a few part-time as well.
Yes. So we have some counselors who kind of do a hybrid model. They'll work in office because we can see all ages. They'll work in the office and go to the school. So we have some like that as well. And I actually need to correct myself because we actually now have 17 schools. We are now expanded. Yeah, we did. We've actually expanded also into Marlboro County. And so we actually have 17 schools now, just getting that started up this year. Yes. 17.
And I know that there's a need in all counties for the services that CareSouth offer. And we understand that maybe over time, whenever we're able to increase our workforce and, have more staff on it, maybe we can bring some of those other schools in. But that's just me. That's on my wish list because I know that Dillon County probably needs some help as well. I'm just throwing it out there, bam, just boom, like a free throw. I'm just throwing it out there. But I am happy that we're there, and we're going to save that school base for Laura to go more in depth.
Yeah.
But you said too that that y'all do all types of counseling. You do all types of counseling. So if I'm having marital problems, can I come to you guys?
Absolutely.
Mm-hmm.
Okay, but I'm not. Me and Stephanie, we happy. That's just for somebody else.
If you had a friend of a friend who had,
I probably got somebody, that, but I ain't, but I'm glad that you offer. So if I'm having familiar problems, maybe within the household and maybe my family, my whole entire family, we just having issues. You guys come in for interventions with that as well?
Absolutely.
What about grief counseling? Do you guys do grief counseling?
We do grief counseling, and we do counseling for individuals, families, marital counseling. That's the great thing about CareSouth and having that integrated model. We really cover every aspect. And grief, we do a lot of grief counseling. And we do a lot. I mean, there's so many different things that people are going through, especially even through COVID. There was just so much that changed for children, for adults, lifestyles that changed. And we were really excited that we were able to offer telehealth services during that time. So we were able to continue to see the children in the school, even virtually, and see the patients at the office virtually. And we've actually continued that service. So we provide both in-office services and telehealth services.
That brings me to a good question that somebody wanted me to ask you. For your telehealth services and your telecommunication services and everything else, the questions are, I'm gonna put them all together and you guys can answer. Okay, is that private? Is it a secure program that you use? And does it really work? Is it really beneficial? I'm echoing.
So,
I'm gonna
say this. So is it private? That was the first question you asked, correct?
Huh?
We're all echoing right now.
Yeah, we echoing. I hear myself.
I hear you too. Not anymore.
Not anymore.
Marek,
Okay, so
you just can't talk.
so go ahead, Robin. Yeah, go ahead. Ask your question again.
So you're asking if those services are private. Okay, so on our end, we use a program called .CME, which is HIPAA compliant, so that we can contact our clients via video, and that is a secure space for them to be able to get services. Now, what's going on their end, we can't always, they've got family members in the house or friends or, but yes, that service is HIPAA compliant. And so we can offer them some secure confidential services.
Yes. And I understand that service is very important too for some people who are still anxious about coming into the office. Also, some who just still have this stigma about receiving treatment. We know that it's a cultural thing sometimes too, that if I'm seeing a counselor, then that means that I'm crazy. Right. And, I don't want nobody to think that I'm crazy because I'm really not. Okay. But that's a cultural thing. So what would you say to somebody who feel like that this, I don't want to come see nobody because I don't want nobody to think I'm crazy, or that I got, that something's wrong with me? Or how do you convince people that the services that we offer as far as behavioral health is a necessary service whenever it comes to holistic health?
So there's a couple of things. So one thing, we've kind of all heard that saying of mental health is health. Mm-hmm. It is part of treating our whole body. And, if we're feeling, anxious or nervous or having some symptoms of just being sad, that, sometimes those are normal emotions that if you're able just to come in and process, we can help you work through those. The other thing with it being Mental Health Awareness Month, NAMI, the National Alliance on Mental Illness, I'm going to quote something from their page because this year's theme is you are enough, or more than enough. And so it says, if you wake up this morning, you're worthy of life, love, and healing. And so, coming in and being able to see somebody allows you to begin that journey of healing. Yeah. And that can be short term, it may be longer term, but it's important because you're important.
And we talk about all the time, we say, mental health and physical health. And the reality is, if a person, has diabetes and they're struggling with keeping their sugar down, they're going to go to their doctor. They're going to work with their doctor. They're going to come up with a treatment plan that is going to help them to manage that disease, right? Well, mental health is the same thing. And that's what we try to really push. Is it's no different than anything else. It's something that you come in, we help you identify what those problems are. We help you to create a treatment plan that is good for you and your life. And then that's how we work. And that's when the healing process starts.
Right. I think that destigmatizing mental health and behavioral health is a big thing. And it's important that we understand that sometimes a lot of our physical health is a direct reflection of our mental health, right?
Absolutely.
So sometimes I can have high blood pressure because I'm so stressed out, right? I'm dealing with so much. I'm internalizing so much. And if I can get those things out by speaking with somebody, it can really make a difference within my physical health as well. But I think destigmatization of the whole entire service that we offer is very, very important. I'm very impressed. I've been here for some years, but I'm still impressed with the model that CareSouth has. That everything that I need is under one roof, and people need to take advantage of that, really. Absolutely. So if I'm seeing my provider, and I urge all of our CareSouth providers to do the warm handoff with the providers that's in your office for behavior. Do a warm handoff. Take them over there and let them meet the person that they're going to be seeing for mental health service, for behavioral health services, and use our providers as much as you can, because they're great. They're a great resource for you and your patients. Right. But also having everything under one roof, as far as my chronic illnesses when it comes to my physical health, as well as my chronic illnesses when it comes to my behavioral health or my mental health. All that stuff is important. Even down to your brother, Amy, because I can be stressed out and my muscles can be tight and tense, right? And Dr. Davis have chiropractic services, which is also a good referral to help with mental health because it helps relax you. And it's just a whole bunch of things that tie together,
Absolutely.
And so having behavioral health and as part of the services here in our community is a big resource that people are not taking advantage of that they should be. And so what do you guys think we can do to make people more aware of what's going on in CareSouth when it comes to behavioral health and mental health?
I think educate. We use this month. We try to educate all year round, but we use this month because it is Mental Health Awareness Month. And some things that we're doing each day on our Facebook page, we are posting one of our behavioral health providers and everything about them, what office they're located in, so that the community can get to know all of our providers and where they're located, what services they provide. But education beyond that, we need to start education in the office. We need to start educating in the school system. It starts when they're children, and with CareSouth, we're providing medical care, we're providing dental care, we're providing behavioral health, even in the school system. And so I think it's starting there, with the children, the adults, just getting the education out there, and also all the providers working together to educate the patients about what services we provide, because a lot of people, don't know.
Right. You educated me because she do. I guess once you're a counselor, you're always a counselor. But there was something that happened, Marek. Now I want you to think about this, Marek, and everybody's listening. I consider myself, I'm a loving person. I love people, right? And I always thought it was a term of endearment when I hug you and I pat you, right? I'm like, oh yeah, you're so good. But Amy showed me something different. Usually when I'm hugging somebody and I pat them, I'm really saying I'm doing this, but I don't feel comfortable doing this, right? And I never thought about that.
Me and Daniel were working on.
And so she blew my mind with that, because then I had to think back over the last 40 years of people that I hugged and pat, and that was by everybody that I encountered. And and I'm like, well, did I really not want to? Did I really feel uncomfortable? And I guess I did. Not that I felt uncomfortable with the person, but with the act of embracing somebody.
Right.
Not that I didn't care about them, but it was just the act of embracing and that physical touch that I felt may have been inappropriate. So to alleviate the inappropriateness, I put the pad in there.
Yeah.
So it wouldn't be like touching people everywhere. You know what I'm saying? Stuff like that.
Yeah, touching people everywhere. That's right.
Yeah, right. So, but then I understand that in order for us to get it, to know who we are and why we act the way we act, sometimes it's good to even informally talk to a counselor. Right. Ask them a question. Right. we have the greatest access in CareSouth. We have availability to our counselors right within our office, right? Yeah. Right. And I have I have a corporate family, and my corporate family includes everybody, but my closer brothers and sisters are those in mental health and behavioral health right now. And so we're like really, really close. There's a bunch of good people in there. And so if I have a question, I got a bunch of people I can call and ask, and I don't have to feel ashamed by asking them. And so if CareSouth is supposed to be a mental home, be a medical home and a place for our patients, then they should have the same feeling that I have, that
That's
all of
right.
our providers are approachable and that we're a
That's right.
family. Right.
Absolutely.
So,
Right.
So let me ask you this, and you may have covered it because I kind of been in and out, in and out. So how do you, how as the provider, medical provider in the center, nurse, medical, how do they know? Because sometimes folks dealing with a struggle, right? But they may not know that, right? So as a clinician in the office, how do they know sometimes a person is dealing with something when the person may not readily come out and say it?
So I'm going to let Robin answer this one, but I do want to say I think CareSouth is phenomenal when it comes to providers who have a relationship with our patients. They don't just know the patient, they know the patient, they know their families. And that, you know, we really push us being a home at CareSouth for that reason, because when that patient comes in, they've been coming here. We, from the front office all the way to the back, we're welcoming them. We're talking to them, and it makes them feel comfortable and actually expressing what they're feeling. And so that's a big part of it as well. And I'll let Robin talk about the other piece that we make sure happens in that process too.
So one thing I would like to say is we have amazing medical providers.
We do.
They work so well with us and so closely with us, and they do a really good job of identifying those needs. And when they identify those needs, they do reach out, whether it is making a referral or whether it's this person needs to be able to see somebody today, like just lay eyes on somebody, because being able to lay eyes on somebody can sometimes take the discomfort away of coming back in to see a counselor, or this patient may need something right now.
Right.
So they do a really good job with that. But every patient, you know, who is, you know, age 12 and up comes into our facilities and they get a screening. Mm-hmm. So whether they verbally share, I'm feeling depressed or I'm having some of these symptoms, they do have a screener when they come in. And so if they fill out that screening and that screening indicates, hey, you know, they might be struggling with some things, the provider then will talk to them. If they need us, they come and get us.
Yeah. Yeah. And the screening and it can ask things from feeling down or sad, trouble sleeping, trouble with appetite, just not feeling like your normal self. So there's a bunch of questions that get asked, and it doesn't just get asked that one time. We do this every year with every single patient because things change in our lives. And so we make sure that we continuously are screening these patients. And if patients come to us and they have depression or anxiety or PTSD or are dealing with grief, we're screening every time they come in the door. With our patients struggling with substance abuse, we're screening every time they come in the door for any changes. And so that's how we really know what's going on. And the medical providers are able to recognize that as well.
And also to add to that, if I came in and I was diagnosed with a new chronic illness, that can be really life-changing for me. Mm-hmm. You know, it can cause a lot of issues mentally. And so one of the good things I have the counselors right on site is that whenever I'm diagnosed with hypertension that I never thought I had, or diabetes, or, you know, other chronic illnesses, I can go over and talk to a counselor to talk these things out, you know, as far even down to HIV, Hep C, all those things are real, that's scary when you first hear it, or even a new diagnosis of cancer or something, you know, anything like that is always good to have somebody there with you to help you talk through that situation, and also to, you know, let you know that there's hope. Even in a, you know, that type of diagnosis, there is still hope. And right. CareSouth offers such great services and have such awesome screening tools when it comes to behavioral health, as far as the PHQ, the DAS-10, the CAGE, all those things. Those things are very, very, very important for us to kind of bring people out, bring those problems to the forefront where people might not be feel comfortable actually saying it, right? I can write a bunch of stuff down that I can't say, right?
Right.
I can write and then when I write it down, I feel it's still getting it off my chest. And then when you come back and I know that you read what I wrote, or you looked at what I wrote and you respond to that and, in kind, with empathy and sympathy, the way that you guys do, it makes me feel more comfortable to come in and have those services done, because once I find somebody I can talk to, I will talk you to death, right? Yeah. Because some of these things we've been holding for years, right? Yeah. And so you may get more than what you bargained for, but that's what you guys are here for. A lot of times you want things, you want everything to come out, right? Because it helps you get to the root of the problem.
And I want to point something else out too. We talk about us as counselors and the medical providers, but the team that we have, our community health workers, our dental teams, they all make referrals to us. We get patients from every avenue. I know you spoke about my brother, Dr. Davis, earlier. I don't know how many times he has sent patients, that are in pain, that come to him and need somebody to talk to. So, I mean, we're receiving referrals from chiropractic care. We're receiving referrals from a patient that's coming in the door needing help signing up for insurance, and may make a comment, and we're all educated, and we're making sure that everybody here is educated enough to know maybe this patient needs to talk to a counselor. So anyone's able to walk over to us and refer that patient.
And I like the good part too about CareSouth is that we even have some lay staff members who are not clinicians or who are not providers that take courses as far as mental health first aid, and then also some of us, just like me and Marek, we are mental health first aid instructors. We're instructors, and so having those courses as well, it kind of help inform the staff, help the staff get through situations and maybe find some issues that they might need to talk to somebody with, the next level of care that they need. Sometimes we don't know what we're going through until we say it.
That's right.
Right.
That's right. And to kind of piggyback on that, CareSouth Carolina, our instructors, mental health first aid instructors, they're available to provide classes in the community as well on how to handle a situation where there's an incident may that occur of a mental health related need, how to diffuse a situation that may occur until further help is able to get there. So we have instructors here at CareSouth Carolina that can come and teach a class. Your organization, your church, your facility, no matter what, both the youth and adult mental health first aid, we can provide that instruction and training for those in the communities, those folks in the community as well.
Right.
And for those answers, for those questions that we don't know the answer to, we have these ladies as a resource that we can call, because we got them on speed dial. Amy know that. I call her. I text her 3:00 in the morning, about the questions. So we have that availability to get those answers that we need to the members of the community whenever you have those questions for us while we're out there, especially doing our screenings and everything else, because this is screening season. So I'm pretty sure my Rex crew is going to pick up a lot, and you're going to also see the MAT department accompany them in some of these screenings. So we want to make sure that we're available in all aspects, medical and mental health, and when it comes to substance abuse. Amy talked about our services, Amy, so I will go ahead and say this. Our MAT program is one of the biggest and one of the most successful programs in the state, and I can almost say in the nation, because we have providers who are willing to offer that service. We offer a service that you have to have behavioral health as well as the medication in order to make it successful. And it's a proven fact through evidence-based information, through SAMHSA, through HRSA, through CDC, that any patient that stays with us for 6 months with consistent mental health counseling along with medication offer better outcomes than people who don't come in for the mental health. So without the mental health part of it, the program will always be unsuccessful. So we have to have that part in order to have successful programs. But we have sometimes these are our partners, Alpha behavior care, and also Rubicon behavior family services. They are our community partners, substance abuse partners for the alcohol and drug agencies to help with those, some of those patients as well for our program. And if I start naming partners, I'm going to miss some. We have so many in the community for us.
We do.
Inpatient, outpatient. We have a bunch of them. So it's a list of them. So which means we have resources available to anybody that need a resource, regardless of what your situation is. But our MAT department is very, very successful. A lot of people don't believe in MAT because they call it replacement therapy. It's not replacement therapy. It's medication therapy. We don't replace one drug with another drug. We use a drug to help you get off the drugs that you're on. And it's not a replacement. It actually blocks the sensors so you'll no longer crave the drug that you was on prior to coming to us. And it helps with your sobriety because once those receptors slow down, the craving for that medication slows down, which increases your likelihood of sobriety. And so that's not replacement. That's therapy. Okay. That's therapy. That's actual therapy. So let's just get more involved and refer more people to the program, because if it wasn't such a big need, our nation and our legislation, our government would not be pushing for more programs around substance abuse treatment.
Absolutely.
So we really need to get people in. Everybody knows somebody.
Yeah.
And if you know somebody, send us somebody, because we got somebody to take care of your somebody.
Yeah.
That's right.
So really send them in to us, and I guarantee you, if those people are committed to their treatment process, to their sobriety, they will be successful in our program, and we'll make sure of that.
That's exactly right.
Yeah.
And we offer that in every single site we offer MAT services in every single site except for one, and that's Sherrall. But Sherrall does do Vivitrol, which helps with alcohol as well as opiates. So in a sense, they're still doing MAT services. So we don't have any barriers anymore. There's no more numbers that our providers can have. Any one of our providers can practice MAT. They can offer those services to any patient. The government moved those barriers, and so now any provider can offer MAT services. And just public information. If there's a provider who's just getting out of school and they offered, they had this course offered to them in school, and they can prove it to us, they will not have to take the required course starting June the 21st through Samson, through HRSA. They do not have to take that course because it shows where they already had the training. And any provider who's already practicing don't have to have it. But if you never practice and you've never taken the course, June the 21st is an 8-hour course that you will have to take to show that you are able to offer these services, because you need some type of instruction. Okay. Nobody needs to go out there blindly treating people without knowing the whole process and how it really works. So that's just my 2 cents.
He couldn't help it. I knew it. He was going to say something. I knew he was going to do it. To be continued.
Absolutely.
Go ahead.
No, I was just going to say, as you're talking about MAT and the medications, and when I think about behavioral health, and oftentimes some of our patients do have to take medications. Just shout out to all the CSC pharmacies.
Yeah.
Mm-hmm.
They do an amazing job. When we
Yes.
talk about, we have integrated behavioral health within this medical office, but then we also have this pharmacy who really meets those medication needs of all of those patients. And so just kudos to them for keeping them all, in line with their medicine. They do a lot.
Absolutely.
Yeah.
Absolutely. Wow.
They do.
Wow.
And also, and while you giving the shout outs, I want to give a shout out to our nurses as well.
Yes.
Since that's my designation, give a shout out to the nurses, because they work hard to make sure our patients get everything they need when they come in. As well as making sure their prescriptions are sent to the pharmacy, or actually doing any prior authorizations needed for treatment. So let's give a shout out to them, because sometimes we forget about that service right there, nurses, and they are a big part of what we do here at CareSouth, and they are so good at what they do.
Absolutely.
So good at what they do. I'm not saying that because I'm biased. Why would I be biased?
Well, everything that we're talking about too is just teamwork.
Yeah, it's
That's right.
teamwork.
Like
That's what it is.
CareSouth, you truly have a team.
That's
From
right.
medical to pharmacy to our front office staff, from being greeted at the front door to behavioral health providers. So from the time you make that first phone call to the time you come in and leave the office, you've got a team who's behind you, and and
Absolutely.
working to support you
That's
in
right.
the journey of healing.
That's right. And Marek, if I can, just for a minute, I want to give a shout out to my daughter-in-law who graduates nursing school tonight as an RN from Florence Darlington Tech. So I want to give a shout out to her. It's been hard, but she keeps her
Congratulations.
across. I am so proud of you. Okay?
Yeah.
Just a shout out. I'm sorry. I had to take
No,
this moment.
that's wonderful. Congratulations.
Congratulations. Yeah,
Congratulations.
absolutely.
Yes.
Yeah, she's worked hard. Absolutely.
Yes.
Oh, and shout out also to Mr. Daniel Myers, who did the keynote speech for Northeastern
Yeah, that's right.
the other
That's
night.
right. That's right. Congratulations.
Thank y'all.
Yeah, that was
Thank
a great
y'all.
honor. Absolutely. That was a great honor.
Yeah, I was humbled by that experience. I was really humbled by that. And I thank Northeastern for thinking enough for me to give me a call to do that. It really meant a lot to me. Thank y'all.
That was awesome.
And speaking of pictures to come, so everybody needs to kind of keep a watch on our social media pages next week. So next week, the week within Mental Health Month, we are having Spirit Week at CareSouth, which means we will all be dressing up each day. Every day has a theme in support of mental health awareness. So we're going to be dressing up, taking and posting pictures, and just come back and check us out.
Yeah,
on the pages.
So
Absolutely. It's going to be a fun week.
it's going to be fun. Yeah,
It's going to be a fun week. I can't wait till we get here.
yeah.
Absolutely. Wow. What a way to come back. What a way to come back. Some great information, 2 great guests.
yes.
Thank y'all.
Celebrating Mental Health Awareness Month. Listen, what a way to come back.
Thank you so much for having us.
Okay.
Absolutely. And I do want to make sure that, like Daniel alluded to earlier, it is festival and event season. So, CARE South Carolina, we offer health screenings. We have a team that can come out, provide some health screenings for you, cholesterol, blood pressure, blood sugar. We calculate your weight and BMI. We also got Daniel's team will be coming out to provide information on MAT, SUD services, behavioral health services, and you can get a lot of other information about CARE South Carolina and the programs and services that we have and how we can assist anybody and any patients with addressing social barriers to care, as well as any other services that we provide. So just be on the lookout at a festival or a community event near you. And if any church and organizations want us to come in and provide their service, we certainly can.
Yes, we can.
Absolutely.
And can access a lot of things on the CareSouth website.
Absolutely.
Page as well.
Absolutely. And also be on the lookout for our CARE South Carolina Healthy Kids program, where we assist families and individuals with signing up for Medicaid services, especially now doing renewals. The PHE has ended. And so states, including South Carolina, have started back addressing individuals who have Medicaid. You now have to start back signing up for Medicaid. And so that ended and started May 1st. So listen, if you're out there and you need assistance with your Medicaid, you receive that package, you're not sure what to do, give us a call, whether you're a patient or not. We can assist you with signing up for Medicaid. We can help you with that renewal. We can answer any questions for you and provide that guidance and assistance for you, no matter what that need is.
Yes.
Right.
And please
Ladies.
call for any need, behavioral health need. Please feel free to call, schedule an appointment. They'll set you up with whichever location is closest to you, or if you prefer telehealth services, we can do that as well. You call our call center and they will get your appointment scheduled as soon as possible.
Absolutely. Well, thank you, ladies. Thank you for joining us today. It was a pleasure. It was great talking with you. It was great being back. It was great being back with my partner in crime there. Listen, we're back.
Thank y'all so much for having us.
Yep.
Absolutely.
Yep.
And we will be right back in the saddle on May 18th with another CareSouth Carolina Community Live podcast, 1:00 p.m. We will be right here on this social media channel, Twitter, CareSouth Twitter, CareSouth Facebook, and CareSouth Carolina YouTube page. So find us. We'll be right back here next week, May 18th, 1 p.m. We're going to bring another series of counselors in here to talk about some behavioral health issues. To get this information, people, we need to talk.
Call us.
All right.
Thanks,
South Carolina.
guys.
Y'all ladies, hang on. Y'all ladies, hang on just for a minute, okay?
Okay.
Absolutely. All right, y'all. It's CareSouth Carolina Community Live podcast. Again, I'm your host, Mark Calhoun, Director of Social and Community Service, my partner in crime.
Daniel Myers, Director of MATSUD Services, CareSouth Carolina.
Absolutely. And
Amy Cook, Director of Behavioral Health.
Robin Gibson, Behavioral Health Supervisor.
all right. Thank you, ladies, again. And we will be talking to y'all, and we'll see y'all on the other side.